Hi, welcome to your Checkup, where we bring topics from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Ed Deleski, a family medicine resident in the Philadelphia area.
And I'm Nicole Rufelt. I'm a nurse.
And we're so excited you could be here with us today. Let's give some shout outs to some distant listeners.
Oh my gosh, we were just checking, and there are people in Australia and Costa Rica.
What? And we don't even realize how.
One singular person in each of those countries, but
somehow they stumbled upon our little podcast, but we're so excited about it. It's awesome.
Oh, also, Pat and Maggie. I hope they're listening in the car.
I hope they're listening in the car. We did say we would shout them out when we saw them recently. So let me tell you a little story. Imagine this.
Oh my God.
You just got engaged. You came off an amazing trip to Jamaica, all inclusive. You get back, you're the heaviest you've ever been. And you think you're going to get yourself back in shape. So you start running on the treadmill and you start running a lot. You're going days. For you, 3 miles a day is a lot. And you're on your third, maybe fourth day in a row. And you're running pit, pat, pit, pat, pit, pat, pit, pat. And you're on that treadmill. You feel a little tightness in the back of your leg. And you're like, that's nothing. And then you leg it out a little bit more. And then 2 steps, 1, 2, bang. I feel like I had a tearing in the back of my leg.
And then you decide to drop $3,000 on a Peloton tread.
What are we going to talk about today, Nick?
It feels like we're talking about calf strains.
I think that's exactly what we're going to talk about today.
That story seemed personal.
This entire episode is a personal attack on me.
You're a survivor.
I am a survivor.
You're the survivor of our family.
I'm a survivor of calf strains.
You're so brave.
And today, my bravery really shines through. My courage stands strong in this episode. And so what I'm hoping to do is to help drag all of the survivors or those suffering with calf strains through this episode. Give them tools to manage and survive like I did.
Do you think you might issue a trigger warning?
No, I don't think it's worthy of a trigger warning.
Okay. So we heard your very traumatic, deeply personal story about your own personal calf strain. So why don't you tell us exactly what that means?
Oh, yeah. So in the back of your leg, of your lower leg, there exist a few different muscles.
So it's not just one.
No, it's not. The calf isn't just one muscle. It's a group of 3 bigger muscles. The biggest one is called the gastrocnemius. God bless you. The next one is called the soleus. And then there's the plantaris, probably the least important one. So gastrocnemius, soleus, and plantaris.
Okay, so the biggest one is usually what people are referring to when they say their calf.
I think usually.
Right? So if you have a calf strain, that's where it's happening.
This is the usual, like you're running around and you make a sudden movement and all of a sudden you feel this sharp pain in the back of your leg.
Sudden movements will get you every time.
And the sudden movement, so when you have a calf strain or you have a gastrocnemius strain, that's from a sudden movement, it's called eccentric. It's a stretching type of load on the muscle in the gastroc, which people will shorten the name to. And
Are there any sudden movements in particular?
So sudden movements,
or is that like not even a question?
No, like
you know how like your ACL, it's like when you're going sideways,
right? Like the ACL is like change of direction. I would say that the gastroc strain or the soleus, you strain even when you're going in a straight line. It's a sudden movement when that muscle is stretching. So that most often happens when the calf muscle gets longer and the heel is heading down and the toes are going up.
So like when you're running.
Right. That's called dorsiflexion. When the toes go in the air and the heel goes down. And that stretches the calf muscle, which if done too quickly and too powerfully can lead to a strain.
So you're just so powerful. You're too powerful for your own calves.
No, I have the legs of a 40-year-old man, and that's why I tore my Achilles. But this is different from the soleus.
So much trauma in one episode.
It's a lot to unpack.
Oh no.
But that's different from the soleus strain. The soleus strain is deeper. It's a deeper type of nagging pain, but it feels more like a chronic issue. It's an overuse injury. And I think actually that's what I had. But overuse.
Is there a way to tell which guy back there that you may have strained? Or is it just kind of like same treatment?
No, they're different
for all of
treatments,
it?
but I would say that the gastroc strain ends up being higher up and on the inside or the outside of your leg. If you were to like grab right below your knee and grab that meaty part, that's your gastroc. And then if you were to go a little bit lower, more towards your Achilles and on the outside, deeper discomfort right there, that's more indicative of a soleus type strain. Plantaris is honestly like the gastroc, but just less severe. Sometimes it's difficult to tell the difference.
Okay, so running is a big one, it sounds like. What other activities might put one at risk? Or I guess just like risk factors in general.
Oh, yeah. So you see this in poorly conditioned males 40 to 60 years old. So practically me. You also see it in people who are taking part in sports like tennis, football, basketball, anything with short ballistic movements like jumping, sprinting. Yeah, it's a fancy word. And boom, calf strain right there. If you warm up, that helps. But by the book, medical literature risk factors include a previous calf injury and increasing age. So if you've already had one, I'm looking at myself in the mirror, I'm more likely to have another calf strain in the future.
Better watch out.
And as I get older, I am more likely to have a calf strain in the future.
Oh no, we're doomed.
I'm doomed. Is it Aretha Franklin who sings I Will Survive? Let's look this up.
Let's look this up so we sound cultured. Probably. It sounds like something she would sing.
No, it's Gloria Gaynor.
Who's Gloria Gaynor?
We're going to catch some heat.
Was she a one-hit wonder? She
No.
had to be. She had to have been.
Anyway. Reach out to us if you're shocked and appalled that we aren't familiar with who Gloria Gaynor is. I do know who Gloria Gaynor is, but
No, you don't.
I remembered the name. It was the alliterative piece that really caught me. So yeah, so we captured, that's the first part, I would say. The first part of the episode is, me identifying my trauma, celebrating my survivorship, and explaining that there are 3 different major muscles in the back of the leg, the lower leg, the gastrocnemius, the soleus, and plantaris, and how they play into what a muscle strain can look like.
I don't know if you can talk about it from your personal experience. Well, I guess you can. How did you manage your calf strain?
So when it happened, I was really disturbed, actually. And I was like...
You were?
Well, yeah, because I had torn my Achilles like several years ago at this point, but that was a big thing for me. And I don't think the two are related, but it was disturbing. And I was like, wow, it's hard to walk. So you're walking around with a limp, and it's painful. I think I didn't have any swelling, but people can have swelling. You can have bruising if it's that serious. Mm-hmm. Sometimes people need crutches or walking boots. So mine was more mild to moderate, I would say. But it stinks. Like, it just...
I feel like also because we just bought the Peloton treadmill and you were going to make us return it within the 30-day window if you couldn't use it.
Well, yeah, because I'm jumping on the one in the store and the actual belt keeps hitting the bottom, and I was like, oh my god.
He's like, we're doing the 30-day trial, and if I can't use it, we're returning it.
Well, I mean,
so your calf needed to get fixed real quick.
Well, yeah, and then you get something like that, and you're so motivated to use it, and then it's right there in front of you, and you can't use it. So I absolutely re-aggravated this because I was trying to rehab it too quickly, and I was trying to do it on my own, which is not the wisest thing in the world. Like, they have physical therapists for a reason. They have people who go to school for this and specialize in this, and at least even to just get advice. And there's a lot of different advice online, but these are the things that we found from various resources. So I would say one of the main key pieces is when you're starting to think about getting better from your calf strain, you have to first rest it, which is so much easier said than done.
It's kind of like the typical when something starts hurting, stop using it.
Sure, like rest, ice, compression.
Throw some Advil there.
Right. Throw in some non-steroidal anti-inflammatory drug, Advil. And so the idea is that if you're able to rest it until you get to the point where you can walk on a flat surface and it's painless and you don't have a limp, you're in a good spot to start thinking about the next step. And that's the most important thing. And that can happen in the course of days, or it can take longer because, I mean, we have an audience that's wide ranging. We have audiences very young and people who are a little bit older who may be tuning in thinking, oh my gosh, my calf strain is never going to get better. It could take a little while. But like we said, ice and compression sleeves are recommended. Those are the usual things. So one thing that we were looking at that lives outside of the usual rest, ice, anti-inflammatory medicines were heel lifts.
And a heel lift is something that it's like a tool that you use, right?
Yeah. It's like a little insert that goes in your shoe and lifts your heel up and reduces the length that your calf needs to stretch to exist in the shoe. It's like almost like you're walking on your toes a little bit, which you might think is counterintuitive, but it's the stretching motion that's more dangerous on the calf at that moment in time.
So are there core universal things to think about with treatment? Once you're kind of at that place where you can walk and it doesn't hurt, where do you start?
Right. I think you have to think about it going the Goldilocks way. Not too little, not too much. If you do too much, you run the risk of re-injury. And if you do too little, you can lose muscle mass, and then you're never going to get back the strength in that muscle that you once had. So the Goldilocks amount of effort and time. I would say you have to listen to your body. I certainly didn't. And there were times when I would be 2 weeks into this personal rehab I was doing, and I pulled it again, which set me back. And it was really frustrating. And so that led me to read more about this, which made me think about three different things. It made me think about how much I was trying to walk, the incline that I was trying to walk, and how quickly I was trying to walk.
That was it's a dark time for us here.
Yeah, it was so frustrating. And, you know, you look at those things and then there lives a world where exercises are important. And if you were to read about this, you would see something called the Alfredson Protocol. This is a set of exercises that are essentially around slow stretching of the calf. So if you were to imagine standing on a step and your toes are on the step and you're on your tippy toes and you slowly bring your heels down to level, especially the calf that is bothered, and then don't come back up immediately on the one calf. You use both feet to come back up and you do like a 3 count, like a 1, 2, 3. As you come down, you bring your heels from up in the air down to flat and then rinse and repeat. Those are essentially the exercises that are key to rehabbing a calf strain. But they actually recommend avoiding stretching exercises, ironically. And that's pretty much everywhere I read about.
Well, that's probably like the same with the heel lift thing.
Mm-hmm.
Like you're preventing that stretch in your calf.
Right.
So then that makes sense.
Yeah.
Right.
Or like incline too much. Like to try to get more of like a cardio workout, I would put an incline up.
Oh, yeah.
And then I would feel it more. So like if you're going to go hiking or anything like that, you have to be careful too.
So we have painless walking. We're doing some of our calf exercises, maybe going to PT. How would you incorporate running again, or like those sudden movement activities?
Yeah. So there's a good benchmark that you're able to get to if you were to look around online, and there are a certain amount of calf raises you should probably be able to do. Each is graded based on your age. But once you get to the point where you're able to hop on a single leg multiple times and it's painless, that's a pretty decent time to start thinking about running. But starting running looks different when you have a calf strain than it does when you didn't.
Is incorporating running, do we start by distance? Is it by time? Do you just go by the vibes? What are we doing?
You know, you can do both. You should use a combination of walking and running. So like, I mean, for instance, me, like I would be comfortable running like for a long distance at a certain speed that's embarrassing to talk about. And that's because I've gotten there now. But in the beginning, I was quite literally jogging for 30 seconds at like 4.5 miles an hour, and then walking for a minute, and then jog for 30 seconds, and then walk for a minute.
So it would be different for everyone, right?
Yeah.
Like if Lauren, your sister who runs marathons, she would probably be starting at a different level
Right.
to reincorporate running.
Totally.
She could probably run for more than 30 seconds at a time.
Agreed. And I was becoming sweaty and out of breath even with that. So you could think of different milestones, like when you get up to 10 minutes of running or 15 minutes of running. But you slowly should increase the percentage of running that you do to the walking. You shouldn't run multiple days in a row. It's tantalizing, especially if you have something in your home that's so convenient, but it'll overdo and you need to give your muscles time to repair.
Is there kind of a general, what am I trying? Yeah. Is there kind of a general timeline? Like I know when you were kind of doing this, you would say, okay, for X amount of days or maybe a week, I'm going to run this much time, this distance, whatever. Mm-hmm. Is there a certain time that you would then consider increasing your time or your distance to try to run?
Yeah, there were ramp.
Yeah, like weeks at a time.
Yeah, there were like ramp up protocols that I read a lot about. If you were to look at mild injuries to the calf, they say about 2 weeks is the whole recovery time, and more moderate to severe is 6 weeks. That's not my experience. Maybe they're talking about return to running, but return to performance is totally different. There were times, let's say I would run 3 times a week, and I would try to get 10 minutes and then whatever that meant at whatever time. And then say the next week at the same speed. And that's notable. I read about this and I was shocked to learn that it was so important that instead of increasing your speed, you should focus on distance first and more time under pressure for the leg when you're actually running. So then you do 10 minutes of running in the first week, let's say. And the second week you can do 15. And then you can increase it a little bit the next week. So that's one way to look at it. And then before you know it, you're doing continuous amounts of running. Then you can think about ramping up the speed. 4.5 miles an hour, 5 miles an hour. Then after that, which I haven't gotten to yet, is a return to like sprinting, where you go hundreds of yards and you leg it out. Like you're trying to get closer to your top speed.
Is that going to be traumatizing for you?
I don't know if we'll ever get there. Am I going to run
exposure therapy?
Going to run down Pine Street? And,
I mean, yeah, why not?
Like Rocky Balboa.
Mm-hmm.
Adrian! Yeah, running up the Rocky Steps will be a nice thing one day. and then you can do the cutting, the lateral movements, which is a whole other animal, which I haven't even begun to dream about doing yet. So it takes a long time. It's frustrating. There were plenty of times where I felt tingling in the back of the leg that I thought was me injuring it again.
Yeah, you said that like last week or something, right?
Yeah, it was like pretty much a lot of the times that I would run. This was disconcerting. And there's always so much reassurance you can give. But like when you're experiencing it, it's like, oh no, is this happening again? I've worked so hard. It's going to set me back.
I'm a survivor.
I'm a survivor.
Well, you're so brave and we're all so proud of you for talking about this today.
I had to be really vulnerable. I did. I had to talk about my comeback. You know, there have been
love a comeback story.
Several different comebacks here in my ligament and tendon health.
Fragile ligaments. You're like a delicate little petunia.
But I persevere. I come back. I'm a winner. And
oh my God. Our intern hasn't said one single peep this whole time.
But he is here. For those of you who think about our intern.
Is he under me? I don't know where he is. I think he put himself to bed.
So here on this episode, we were able to outline for you my personal trauma, what a calf strain is, and from my own personal experience and doing some reading for you guys, how to go about general broad strokes, the approach to rehab. But you should get yourself a physical therapist.
That you should.
Any other?
They can give you more exercises to do.
That's
things
so
to do
true.
at home.
Yeah, and you don't have to go. You could invest in it. You could invest in going 3 times a week, as many times as whatever your insurance allows, or you can go once and you can be upfront with them and say, "Hey, I don't have a ton of time, but I want to make the most of this. Can I do X number of sessions?" And try to learn as much as I can from you and make a plan for this. And maybe they'll be reasonable if you're upfront with them. Who knows?
Yeah.
I love my physical therapist who got me back from my Achilles. Notably, the surgeon who did my elbow said, don't go to a physical therapist.
Why?
I don't know.
Seems like a thing a surgeon would say. I mean, let's be honest.
That's, yeah.
No offense, Justin.
Sorry, Justin. Okay, well, I think that's everything we got for you guys today. We're so grateful that you came back out. Make sure you subscribe, rate, and review wherever you listen to your podcasts. Follow our Instagram, Your Checkup Podcast. And most importantly, stay healthy, my friends. Until next time, I'm Ed Dulesky.
I'm Nicola Rufo.
Thank you, and goodbye.
Bye.
This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. We explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.